because for this next segment, it will be, and it has been said a little bit already, all about adaptation and mitigation of healthcare systems to climate change, because as we say, there are two sides of the same coin. Now, we'll be looking specifically at what are adaptation strategies for the healthcare system. We'll also be looking at ways in which we can mitigate the ecological footprint of this specific sector as a whole. I won't keep you in suspense any longer, because we've had a no spoiler from Francesca. I've been doing a bit of lead up to it, so I think it would only be fair to just hop right into it. And to do that, it is with great honor and excitement that I can introduce the very first speaker for this specific plenary. She is the co-chairman of the International Committee on New Integrated Climate Change Assessment Scenarios. Everybody, can we have a big round of applause for Kristie Evi? The clicker is there. Oh, and before we start, I will say, if you have any questions, please make sure to scan them and send them in through Slido. Again, you will have the QR code on the back of your badge. And then the floor is all yours, Kristie.
Thank you very much. And for those of you who know me, I'm still at the University of Washington. I am also the co-chair of Iconics. There seems to be a little confusion about that. I'm really honored to be here to talk with you today, although it's slightly daunting to think I have 9 minutes to cover everything about adaptation and mitigation, while it's 1 o'clock in the morning for me. So I'm counting on all of you for all the things that I don't get to put questions in so that we can talk about them later. I'm going to start with the framing from the Working Group 2 contribution to the 6 IPCC assessment cycle. And this makes a couple of really important points for the discussions that we're having. You heard several times yesterday about thinking about risk. When we look into the future, we're looking at risk. In the IPCC framing, risk is composed of 3 main factors: the hazards created by a changing climate, the systems that are exposed, the human and natural systems that are exposed to those hazards, and then the underlying vulnerability. It's important for health to divide vulnerability into susceptibility to harm and our capacity to manage, because both are critically important for thinking about risk. But this framework moves on and says we're past the time when we have to focus on characterizing risk. We now have to look at our solution space, specifically climate resilient development. We need to think about what it is that needs to be done to increase the resilience of our communities, to make sure that we are putting the future in a better space. As Francesca just said, doing so requires transdisciplinary approaches. We do have to partner. I'm not European, so I'll be slightly politically incorrect here, but the challenge in health of the transdisciplinary approaches has been health. We're not reaching out to other sectors. We're not trying to make those bridges that we need to make. And we need to work much more diligently to make sure that we are working together. Over the course of my career, I've reviewed probably close to 1,000 proposals. And it's just amazing to see health proposals with dozens of people involved from the health side and nobody from meteorology or climatology. That's just not acceptable going forward. The other point I wanted to make from this slide is it's very integrative. And when I think of integrative, I think of my governor. I live on the West Coast of the United States, who's trying to look at climate resilient development in the face of heat waves, wildfires, floods, droughts, sea level rise, emerging infectious diseases, all of it, all at the same time. And thinking about how we can better integrate the work that we're doing to make sure that it's useful, usable, and used. Almost a decade ago, WHO put together the operational framework for climate resilient health systems. It's an extremely useful framework for thinking about the categories in adaptation, the kinds of things that need to be done. One of the main challenges we're facing in health is that all of the health risks of a changing climate are current problems somewhere. It's not that we don't know how to control dengue, we're often not doing it, but we basically know how to control dengue. But how do we control dengue in a changing climate? And how do we bring climate change explicitly into our framing, into our policies and programs to make sure that the policies and programs will evolve, will be proactive, will be ready as the climate continues to change. That's where a lot of the challenges lie. Related to that is one of the building blocks is conducting vulnerability and adaptation assessments. Essentially, all countries, all regions, when they start thinking about climate change and health, and this is true for all other sectors, conduct vulnerability and adaptation assessments. There's an extension of that that I think should be better discussed within the framing of adaptation, which is conducting stress tests. We're all seeing extreme events that are so far beyond historical recollection that we are just unable to cope. And so thinking about new techniques that we can use to help better understand how we can manage and prepare for these very extreme events. There's similar challenges with healthcare. We have to focus on healthcare as well. And I put in the bottom right a figure that's very similar to what Jan Semenza put in yesterday. So we're all thinking along the same lines of thinking about how do we reduce the magnitude and the pattern of risk. And that goes to the question we just heard about hope, that we have to talk not just about the risk, but the fact that if we're proactive and effective with adaptation, if we are urgent in reducing our greenhouse gas emissions, then most of the projections will not happen. Millions of people don't have to die from climate change. It's in the power of public health to really make a difference in this regard. This is a figure from the IPCC 6 assessment cycle. Sorry about the quality of the figure, but I didn't have control over that. But it does show you the solution space, the kinds of activities that need to be undertaken. And I put that up in contrast to what's on the right because public health has been incredibly effective for the last 150 years, usually using reductionist approaches. They're not going to work in the face of food and water insecurity and safety. They're not going to work for the challenges that we face. Jan yesterday talked about lateral public health. It's something that he's put together and is really advocating. In the United States, we've got Public Health 3.0. Public health needs to reconceptualize itself and move from these reductionist approaches to being much more proactive, much more integrative, because we're not going to be able to achieve the kinds of gains we did over the last century and a half using the tools and the mindset that we've had. We've heard a little bit about what we need to do. The next question is how we're going to do it. And you'll hear later today there's a session that'll talk about implementation science. And implementation science has been established for quite some time, and it gives us best practices, lessons learned on the actual how we're going to make this work. From my perspective of working in adaptation for about 30 years, one of the real powers in implementation science that's different from what we're doing is to explicitly look at readiness. I'm working with a brilliant PhD student, Chris Boyer, who's right now looking at readiness in terms of early warning systems in the Pacific. How are we going to do this handshake from the climate services that are growing every day to making sure that we can effectively pick that up? And so looking at issues like readiness, making sure that we are really prepared to be able to do our part in these partnerships to move forward on adaptation and on mitigation. On mitigation, you heard yesterday, health sector is responsible for about 5% of all greenhouse gas emissions. Airplanes are responsible for about 2%. That 2% has really galvanized the industry. Electric planes are being developed. New fuels were advertised yesterday on BBC News. There's all kinds of work that's going on in the airline industry to make sure that they get their emissions under control. We're not there in terms of our healthcare. There's a lot that needs to be done, and there is not really at this moment the energy, the enthusiasm, and the incentives. It's starting to shift, but a lot more needs to be done in this space. Catherine Tunney yesterday spoke about health co-benefits of mitigation policies and technologies. She did a very effective job. I won't repeat what she had to say. But we know from quite a lot of research that the health benefits, the avoided hospitalizations, the avoided premature deaths from mitigation policies and technologies are of the same order of magnitude, if you quantify them, as the cost of mitigation. We should be mitigating for our health. At COP27 in Sharm el-Sheikh, a small group of us met with the EU negotiators. And this is one of the issues that came out during the discussion was health co-benefits. There was no EU negotiator in the room who knew about the health benefits of mitigation policy. That information is not getting out. We need better ways to communicate. I know, I'm close to the end. I had the privilege a year or so ago of working with a climate rapper who does only peer-reviewed raps. And he's got a wonderful rap, his name's Baba Brinkman, about the health benefits of mitigation. I will reveal some of my prejudices and say, I don't think any of the EU negotiators look at climate raps, but there's gotta be some way to get to the negotiators so they understand this. Yesterday, you heard from Sir Andy Haynes about Pathfinders briefly. It's something that just was released. I encourage you to take a look at it because it's looking at how to have a just and equitable transition and looking at what is actually being implemented and demonstrating the value of it. And then finally, we need to have a vision. We need a vision not just for the health sector, we need a vision for society of what the future could look like. We're not going to be able to stop climate change for several decades. But that doesn't mean that life has to be worse. It doesn't mean that people need to suffer. And so there's ways of coming up with visions, of making sure that we as a sector communicate a strong vision. We've heard a lot about mental health. If there was a strong vision of how life could be better in lots of dimensions, including addressing the inequities that are at the core of climate change, then we would have more people working with us to try and make a difference in the critical issue that we're facing right now. Thank you.
Thank you so much. Everybody, can we have a big round of applause indeed for Kristie? And maybe if you stay with us for just a moment longer, Kristie. Also, I love what you said at the end, and it taps into the takeaway you had also that aligned with what Jan said yesterday, not being driven by a fear for the risk and sort of like the detriment that would await, but being motivated and inspired by the hopefulness and the vision that we need for that future. What would it then look like if we go to the good side? I love that. Also, many questions came in through a Slido, so thanks for sending them in and keep on doing it. There's one in specific from somebody that wants to ask you. We keep on talking about transdisciplinary in terms of collaboration. Should we also make more space for transdisciplinary people? So between brackets, they say generalists. What would you say? You're smiling. Oh, no.
Of course. But we need to have people who can talk across disciplines. We need to be able to collaborate. And so, yes, we absolutely need to have people who are generalists.
Yeah.
And part of the reason I'm smiling is there was a president of the United States many years ago that I used to make fun of. And there was comments that his...
Who was it?
It was one of the Bushes. But it was Father Bush. And
nice.
The comment was that his technical knowledge was a mile wide and an inch deep. And I realized I'm pretty much in the same situation.
Oh, no.
I know a lot about a few things, but it's very difficult. We have to marry these deep dives as well as people who are generalists. We have to have both. We can't move forward without that.
Yeah, I like that. Thanks for the story also that's been shared in the analogy. Everybody, can we once more have a big round of applause for Kristie Ebi? Thank you so much, Kristie. Moving on to our next speaker, I'd say let's keep it rolling. She's here at the front row, so I'm very welcome to the stage the head of unit on climate adaptation and resilience at DG Climate Action at the European Commission. Everybody, can we have a big round of applause for Elena Višnar Malinovská? And the floor is yours.
Should I use this one?
If you want, whatever you prefer.
Good morning, everybody. Good health to everyone. If you need to stretch a little bit, you are allowed. We are in a health and climate conference. So thank you very much for inviting me, and thank you very much also for the reflection I could be part of, just to dive into your memories of yesterday. For us in DG Klima, the climate and health nexus has been sown also slowly, but it has grown nowadays to a big policy agenda. And I would like to give a big applause to my colleague Peter, who is sitting there, because it's also his contribution. There are always people behind policy initiatives, remember. We see health, a narrative of health, as a key driver for climate action, definitely, and climate action contributing to health. Clearly, on the mitigation side, the Union is doing well. We have the start of a conversation over the target for 2040. We have an agreed climate neutrality target for the Union. And of course, depending on the sector, agriculture, industry, power, there are specific mechanisms as to how to cut greenhouse gas emissions. For the health sector, however, there is no such a specific mechanism. And that's why it is important that the sector mobilizes. I have my daughter who is a climate activist and who is in second year of medicine and could do her stage in a hospital last year. For a climate activist, it is very hard to see the operations of a hospital where you see a lot of food waste, a lot of waste, a lot of plastics, etc. So for her, it was quite soul-searching. But I told her, look, the sector is trying to deal with its carbon footprint. I have at least a comforting message for her. So it is very much welcome, and I thank all the health professionals who are pushing for this from their perspective. As a head of unit that is responsible for adaptation resilience, and I must tell you, it's not an optimistic job, but we need to keep on going and to be hopeful. I can tell you that despite the fact that we are cutting emissions, we need already to adapt and to predict the impending impact that are out there. Disasters are helping us a little bit, but that's not very comforting either, because we should minimize, avert these impacts, and we should avoid these disasters to happen in the first place. We have had the same figure as the 2003 figure that you, Francesca, mentioned for Europe. We had it in 2022. So we are not yet there to prevent the huge cost and the suffering for humans, for their families, and for communities. Now, on the upside, we have in Europe a climate law that sets a duty to adapt to our member states and to the governments. Governments have been mentioned also in the reflection as an important actor, as an important part of the decision-making chain. And our recent assessment of member states' activities shows that there is some good progress. Health is often pinpointed as a sector where action is needed. At the same time, our assessment suggests that the policy preparedness is rather low, the policy implementation is slow, the finance is not yet there, and the impacts are already outpacing us. So what we do from the position of Director General responsible for climate action together with the European agency, we are preparing a public good project, which is the European Climate Risk Assessment. And in this risk assessment, we look also at health, but also at other systems on which our human societies are built. And this is looking indeed into cascading impacts, cross-sectoral impacts. This will be issued in March, and it will stimulate a response by the Commission as to how we will follow up with these climate risk assessment at the union level. So the risk management is not anymore in the tragedy of commons perspective. We need to allocate the responsible level. We need to allocate who owns the risk, who needs to make something about it. And that's really important to get ahead of the challenge in front of us. We have heard from previous speakers about the momentum in Dubai and also in Budapest, where important political statements and commitments were made. These should be, of course, part of the health sector reform, taking into account also the aging population, the increasing cost of healthcare, the difficulties in dealing with infectious diseases, and the introduction of technologies. We have also a new global goal on adaptation, as was mentioned by the youth representative, where the commander's intent behind the text is indeed to attain the resilience against climate change-related climate impacts, to promote climate-resilient health services, to reduce the morbidity and mortality in particularly vulnerable communities. Now let me come to the relationship between mitigation and adaptation. It has never been an easy one. It's been often portrayed as one is the plan B to the other. Let me get it straight. We need to do both of them and everything at the same time. And this is where the challenge gets really big. We have the policy frameworks for both. We have the legal requirements. We have the political commitments here in Europe. So what I am getting at is that this relation may be complex. It will require tailored measures. It will require hard conversation about difficult choices, about trade-offs. But maybe the health sector is actually a model sector where you can bring both these mitigation and adaptation perspective and show that this is feasible in a policy field that goes beyond the purpose of only protecting health or only reducing emissions and avoiding impact. It's a whole story. It's all about climate. It's all about health. Thank you.
Thank you so much, Elena. And if you would stay with us for 1 minute longer too, there's also a question for you from the audience. You mentioned specifically the risk assessments, right, that need to be done. Somebody's asking, how do we ensure risk assessment methods don't exclude already vulnerable groups that often fall under the radar? So that's a question somebody's asking. No pressure, easy one. I would say, do you need a microphone?
Yeah. It's an easy one and not an easy one.
It's very much not an easy one, I would say.
When we looked at the member states' assessment, and one of the questions was, how do you communicate, how do you interact with your vulnerable communities? There was a big silence in the written template that they have to submit. So this was part of our recommendation. Please talk to your vulnerable communities, because this is, I mean, you have seen it on the slide from Kristie. It is very important when you assess the risk, the exposure, that you know also where the vulnerabilities are. Yeah. And often climate comes where the vulnerability are already there, whether it's it's a preset vulnerability, whether it's unemployment, it's a precarious situation, no financial means, etc. Yeah. So it adds on the top of already existing
issues.
Yeah. So for us, what is very, very important is just design the processes so you can reach out to the vulnerable people.
Yeah.
And I know today is everything online, everything is, somehow in itself seen as inclusive, but you really need sometimes also knock on the doors in the communities, have your envoy or a representative contact in these neighborhoods. And a lot of adaptation measures are actually very local, are very much in collaboration, outreach, and contact.
That's also a takeaway, right? That there's a lot of work to be done, and that there's much more that we can do by reaching people out on the ground. Yes, it's good to have hybrid options in an instance like this, but also in research and other sort of outreaches, go on the ground and go find the people and don't just wait for them to find you. But a lot more work to be done. Thank you so much, Elena. Everybody, can we once more have a big round of applause for Elena Višnar Malinovská. And thank you for the questions also. Please do keep sending them in. Again, you can find the QR code to Slido on the back side of your badge. So make sure to send us in more questions. As we go over to our next speaker, we already saw her earlier this morning. So it is with great pleasure that I would like to reintroduce to the floor the head of office for the Regional Office for Europe at the WHO European Centre for Environment and Health. She's already here, Francesca Racioppi, everyone. And the floor is yours. We do a curtsy again. I love it.
Thank you.
And, I think you need a microphone.
Yes, microphone? Yes, it works. Okay. Thank you. And thanks also to my colleagues who have been instrumental, not only in preparing this presentation, but most importantly in doing all the work that sits behind this for the last several years. So without, I told you no spoiler, because I'm going to tell you a little bit about how member states, particularly in Europe, in the WHO European region, 53 member states, EU countries plus, are trying to translate what Chris so eloquently put in front of us into policy action. So you already might have seen this slide yesterday, probably with Maria. So these are three main areas for us of action. So the strengthening the climate resilience of our health systems and decarbonize them, walking the talk. Making a change in the mitigation policy by showing the benefit and actually the co-benefits of those mitigation policies that address air pollution, nutrition, transportation. Why? Because they deliver the benefits and the dividend not in the 30, 40, 50 years that are required to stabilize climate, but this year. This is a very underused argument that we have with the policymakers. Your dividends from the investment into protecting health by reducing air pollution are immediate. And this is something that should make everybody super excited. And then the adaptation part. Now, in Europe, we had a fantastic opportunity just a few months ago to bring together ministries of health and ministries of environment from the 53 countries. They do this every 4 or 5 years in a series of ministerial conferences on environment and health. And then they set their political agenda. And I underline 3 times there. They sit in the driving seat. And it has been exciting to see that in Budapest this summer, they acknowledged that we need to address the so-called triple crisis, so this intertwining of issues that I was alluding to before. And they wanted to do this using the window of opportunity provided by the reflections and the building forward better from COVID. In Europe, we have had a tremendous window of opportunity because, for example, of the huge amount of resources that have been mobilized through the recovery funds. So can we use these funds to do something that is beneficial not only to prepare us better and to rebuild the economy after the COVID crisis, but also to deliver health benefits, including because we are getting more resilient, including because we are adapting better to climate change and we are addressing its root causes. And when it comes to climate change, in the Budapest Declaration that I invite you to read, we are super proud that our member states could find a political consensus around it. You will see that there are a set of clear commitments. You may find that this says, okay, yeah, we already heard about it, we know about it. But you know, organizations, international organizations and governments are complex animals. They don't move unless they have a mandate. So what is very important in this declaration and in any political declaration, in the World Health Assembly resolution that Maria told you is coming this coming May, and the declarations that have been signed, is the mandate. If governments have a mandate to act, they will set in motion the machinery that brings the resources for that and the actions that you need to take the agenda forward. So this mandate is about making, and commitment is about making health systems and facilities climate resilient. Chris, you will be happy. They want to do that. Establishing health sector targets in the national planning. We want to know where we are going, and here the importance of data that was so much discussed yesterday. They want to develop health national adaptation plans, because adaptation plans have been relatively silent or poor when you look at them when it comes to their health dimensions. And they want to develop health action plans. We want to be prepared. We want to know what to do. And we want to reach those who would be most vulnerable. We want to do this round the clock, and we want to do this in the infrastructure, for example, also including the climate resilience of water and sanitation services. And I would add also the food systems. Food systems are a bit peripheral to this agenda, but they are there. And then strengthening natural disaster risk reduction and to develop early warnings and surveillance systems. So after this, we will go and have a toast together, right, Chris? And strengthening the climate literacy of health professionals. We need that desperately. We need that because until now, it is only a handful of ministries of health that have a department dealing with climate change or ecologists working in their ministries. So there is a gap in research when it comes also to governance, not only in specific disciplinary knowledge, in how to get things done. And this is why in Budapest we were super happy to see two things. On the one side, we had a group of countries that come together on a platform which is called the Health in Climate Change Working Group. They've been working together for a long time, and they have developed their paper, their call to action to ministries. Those are the civil servants in the ministries raising their voice and saying to their government, we want to scale up action in a way that is forward-looking. And the other thing, I told you before, we need the communities of practice. We need community of practices, and we have another group of countries led by Ireland who are coming together to learn from each other. This is beautiful. And we are doing this together with the strong partners, the European Commission, the European Environment Agency, the Lancet Countdown, because we need to maintain this constant osmosis between the policy and the science and the policy. We need this continuous dialogue and bridge. And then I'm going to close with a teaser on the two forthcoming political developments that we expect at the WHO. One will be, after nearly 20 years, a new World Health Assembly resolution on climate change that we expect to be passed in May this year. And then, once again, we hope to see the continuation of a tradition that started in Dubai at COP28, and we hope to see continuing in Baku and next year in Brazil. Taking this forward, my last word is to recap something that I'm sure my colleagues were mentioning yesterday profusely, how we are working together through the so-called ATASH initiative, the Alliance for Transformative Action on Climate Change and Health, that is helping and supporting member states through a global community of practice to take this forward. And with this, I'm thanking you for your attention, and I hope that you feel as excited as I am and as the whole of WHO is to see this uplifting and getting the ownership of the agenda. This is the game changer. Ministries of health are waking up and they are owning the agenda. They are not only listening to the researchers, and this is fantastic. Thank you.
Amazing. Everybody, can we have a big round of applause for Francesca Racioppi? Francesca, thank you so much. Thank you so much. And I love the final note that you end on, indeed, taking ownership of the agenda. There is a short question. We're really flying through time as well here. From Colin that I wanted to ask to you. He's specifically asking, do you see genuine capacity across the health sector for the skill of outreach that is needed? And I'll give you the microphone back if you'd like to.
Not yet. Not yet.
Yeah.
We must still build that, and this is one of the important lines of work that we have to do. We have to get the right people with the right skills in the right place.
Okay.
This is what I was alluding to when I was speaking of still a big problem of governance.
Yeah, indeed.
It is all of this, and the resources to do that.
Yeah.
So.
Okay,
yes.
clear. And thank you so much. Once more, everyone, can we have a big round of applause for Francesca? If the microphone is not gonna drop, it's gonna drop. So I'll keep it in my hand because we're going over to the next speaker either way. Because if there is anybody that can really speak to the importance of adaptation and mitigation within the healthcare sector and the role of the sector, then it is our follower speaker. He is the global head of sustainability at Philips. Can we please get a big round of applause, everybody, for Robert Metzke? And this one's yours. Good luck.
Thanks so much. Yeah, good morning, ladies and gentlemen. It's a pleasure to be here, and it's actually good to see the confluence of agendas that John and Drake was mentioning, and I think these agendas need to come together because we all have skin in the game. Not just as citizens or from our institutions, but also personally, right? My house is 2 meters below the sea level. I saw my parents both, they were above 90 last year, suffering from the heat waves that hit the cities. And I remember Vanessa Carey speaking very clearly about we should stop talking about climate change, measuring climate change in degrees Celsius. We should talk about the millions of people that we can save from suffering. So this is the state where we are in. And Francesca very eloquently spoke about adaptation, of course, but mitigation is also very important. And I wanted to bring in the industry perspective. Of course, you all know Philips as a household brand, but being healthcare professionals also, you know that we are one of the leading health technology providers in the world. So let me share a little bit from that perspective where we stand. It has been said yesterday and has been reminded today, the healthcare sector is not sustainable. Fundamentally not sustainable and not accessible also. Healthcare is not just on the suffering side of climate change. Healthcare is also massively contributing. The emissions from the healthcare sector are exceeding the emissions of all airlines and all shipping lines. And that in an era where half of mankind, that's 4 billion people, do not have access to healthcare. Think about it, right? It's only half of mankind that consumes already so many resources and contributes so much to emissions. So if we want to really make healthcare accessible and believe in universal access of healthcare, we need to find ways also to dramatically reduce the environmental footprint that is required to keep populations and individuals healthy. You see some facts and figures here, but 10% of the global material use, 100 gigatons of raw materials are dug up every year. About 10% of that go into the global healthcare sectors. And again, being reminded, only half of mankind is using these resources. 13 kilograms of waste per bed per day in hospitals. Hospitals are typically some of the most polluting buildings in any built environment. But it's important to also remind that 70%, more than 70% of the emissions in the healthcare sector are actually outside of the hospitals. So it's in their supply chains, right? And that's, for instance, where technology providers like ourselves can play a role and should play a role. Let me see, yes. If we zoom out a little bit beyond the healthcare sector, of course, then we know that the Earth Overshoot Day is somewhere in the middle of the year. It's in July on a global average. I think it's May in Holland, where I live today, which means more than half of the year we are living at the expense of future generations. 90%, more than 90% of the used material go to waste globally. You may have seen the global circularity gap report. So 10 years ago, the circularity of global industries was still around 10 years. Tendencies declining. The global circularity gap report this year published was about 7.2% globally. So we really need to change things. And you see this has enormous impact, of course, on climate change, on biodiversity, waste and pollution, which on their turn, again, put an additional burden on the already stressed healthcare systems. Now, what can we do? I think there are a couple of horizons to think about. The first, of course, that we can influence, for instance, as technology providers, to think about energy efficient equipment, really thinking about energy efficient and carbon neutral solutions, which basically addresses scope 1 and 2 from a hospital perspective. But if you want to address the 70% of emissions that are outside of what's happening in the hospital, then you need to address global supply chains that are required to fuel and drive the healthcare systems, actually, and empower healthcare providers to deliver healthcare. Which means you need to think about circular solutions. You need to think about decarbonizing global supply chains, right? For instance, we have 15,000 bill of material suppliers as Philips. Now, we have been operating carbon neutral since 2020 globally. We have our own wind farms. We use 100% renewable electricity. We have reduced our operational carbon footprint with more than 80% in the last 10 years. But it's important to share these learnings with these global supply chains and to reach out to suppliers also as a care provider to really think and speak about what you are purchasing to make sure that there are harmonized green procurement guidelines, especially also green public procurement guidelines, to trigger these global supply chains to invest in more energy efficient, more dematerialized resources. So circular economy is really, really important, addressing also the global supply chains. Last but not least, and we need to pick up people, of course, where they are today, but it's really important also to think about how care is being delivered, to really optimize care pathways and align clinical outcomes with environmental outcomes to make sure that we not only deliver better care, but we also deliver better care with a lower environmental footprint per patient. There are a couple of technology trends that are in our favor. If we use them and if we trigger these incentives, for instance, through purchasing agreements and so forth and so forth. But connectivity, of course, digital infrastructure. Connectivity, for instance, can help to deliver care in remote areas, to reduce patient movements, to avoid that people need to come to the hospital, which are very energy and material intensive. Digital infrastructure and digital solutions can help to dematerialize big and heavy equipment and provide better care with lower environmental footprint. And of course, data and artificial intelligence that can really help to optimize care pathways, find better designs, and so forth. So there's a lot of stuff, and I know that has been mentioned yesterday as well. For sake of time, let me just mention a couple of examples that have been published about, so you can read up and familiarize yourself with the details of that. Just a couple of examples from recent months that we've been working on. Champalimau, one of the leading cancer research institutes in Europe, situated in Lisbon. So we have a long-term contract with them to help reduce the operational carbon footprint with 50% in 5 years' time. Rennes University Hospital, where we have a 5-year strategic partnership to really do research on life cycle assessments, understand the impact of different technology choices and care pathways on the environmental footprint. And Vanderbilt University Medical Center, where we have just done a study across all different imaging modalities to really understand end-to-end environmental impact of clinical choices also. So all this is available, and I hope that inspires people to look what can be done and works in practice together with clinicians. I mentioned earlier, I think and I believe that public procurement and also green procurement are really, really important. These are triggers that help signal to the industry what is rewarded and that drives change in global supply chains. So really thinking about not just requirements for suppliers to commit, for instance, to science-based targets for scope 1, 2, and 3, but also to report and use methodologies like the Greenhouse Gas Protocol, the Carbon Disclosure Protocol, and science-based targets, which are externally validated, so that there's not just commitments and greenwashing, but also actually visibility on tracking and actions. Circularity is important. I would very much welcome also more transparency at a product level, for instance, through environmental product declarations, green passports that are standardized, that would help. And of course, it would make a lot of sense, and there's a lot of legislation coming from Europe when it comes to disclosure also, and not on the environmental, but also on the social impact of these global supply chains. Last slide from my side. It has been said before, we need to team up on this, right? So the industry, of course, can provide technology and innovation at scale, but I think the regulators need to make sure that there's transparency. Public sector can play a huge role in harmonizing green public procurement around it, and non-profits, of course, are a beacon and a mirror that keep society honest and also can help spread best practices. Thanks so much for your attention.
Thank you so much. Thank you. Can we have a big round of applause for Robert, everyone? Thank you so much, Robert. There are a couple of questions that are coming in, but one question that I wanted to start off with is, first off, thank you so much for showing that. And the statistics you showed at the beginning are also quite stark. 71% is scope 3. Supply chain mostly, and that's also why it was so interesting to me that you said that we can tackle it systemically by making sure that our procurement is sustainable, and that we're very wary of that from a supplier side, but also when we buy. What is needed to accelerate that? Because we're probably not where we need to be when it comes to sustainable procurement in that side. So how do we accelerate that base?
Yeah, I think it's a fantastic question. I see a lot of hospitals and care providers that really struggle with that. There's a lot of interest. There are thousands of hospitals that have committed to become carbon neutral, but they often don't know where to start. They're undersourced, so there's good intentions, but then if the chief of staff appoints somebody to look into this on Friday afternoon, it's not going to happen.
Right. Yeah.
So we really need to leverage the core processes of hospitals. I would love to see hospitals, care providers, care systems to team up and exchange best practices and agree on standards. I think the European Commission and legislators can help and support that.
Right, I was going to ask you, is there
very
something?
Much. I think so. The European Commission should also think about funding these efforts of care providers to make sure that they have the capacity to develop that type of knowledge and develop and harmonize these type of procurement standards.
Yeah, yeah.
I don't care what they come up with, as long as it's standardized
as long as they do it. I love that. Just get it done. That's the main message. Maybe I just want to ask you this because there are 4 people that have asked this, so I feel like I can't skip over this, but if you could be brief, even though it's a very important question. People are saying you pointed to data usage and technologies as well, but some people are also asking data usage and safe storage is also very energy intensive, especially at scale. How is that being accounted for in the solutions you are proposing? Maybe briefly.
Yeah, it is so, like any new technology. So I think it starts with awareness. There's green data and coding alliances. There are new standards being developed. We use this also at Philips. I think it starts with awareness.
Okay, yeah, to look at it. That was very brief. Thank you so much. Everybody, can we once more have a big round of applause for Robert Metzke? Thank you so much, Robert. Thanks. Thank you so much. And that brings us already to the final speaker for this plenary session. Can I get a lot of excitement for our next speaker? She is environmental controller at Karolinska University Hospital. Everybody, can we get a big round of applause for Katarina Ask? There she is. This one is yours, and the floor too. Good luck. Yes.
Hello, everyone. Nice to see you. I hope that you are ready for this conference kind of late admission wild card, because I realized yesterday when I was sitting here that everything felt so inspiring and interesting, but I thought, what the holy am I doing here? I'm not a researcher. I'm not a policymaker. I have no medical background whatsoever. But I realized slowly that my role in this context would be that I'm a translator. I work every day with different kind of policy and political decision-making that needs to be translated into action, something that we have spoken quite a lot about these 2 days. So, first of all, I would like to thank you so much for inviting me and giving me this opportunity to present one example out of many that kind of complies the visions and the hopes that we all share, and how this can be turned into practice. I have no idea how to operate this. I'll start with the arrow.
The green button?
The green button, thank you. So first, to give you a bit of context. Karolinska University Hospital, for those who don't know, is situated in Stockholm, Sweden. We have 2 main hospital buildings, one to the slightly to the south of Stockholm and one center north. We are 16,000 roughly employees working at Karolinska, and we have 1,100 hospital beds that are open. So since we have a limited amount of time, I've decided to cherry pick a few things that I find interesting about what we have achieved at Karolinska. First, the new hospital building that we moved into or started moving into in 2016. It was decided quite early on that this was going to be a sustainable building. But what does that mean? So the first thing you have to do, of course, is to do a risk assessment. And we came up with a number of things. I was not part of this, I should say, but they came up with a number of things that needed to be addressed to make this a sustainable building. Of course, you need accessibility. And that doesn't just include getting there by car, but you should be able to go there by commute as well. And also, of course, if you want to bike to work, you can. We focus on consumables. Like previous speaker said, we use a lot. And we need to think about this when we construct the building as well. Waste is a product of it all, of course. We have roughly 30 different fractions, I think, that we sort every day to try to make sure that we take care of this waste in a responsible way. We looked at energy, of course, the big factor, but also chemicals, pharmaceuticals that we use every day, different kind of transport solutions, and also a good working environment. Now, since we're talking about climate change today, I've decided to focus a bit on electricity and energy consumption. We used the LEED system. I don't know if you're aware of it or recognize it. It's American standardization, I think. That kind of helps you actually to guide you towards setting a standard for how much different kind of environmental impacts you can have to reach certain levels. And we said, we're going for gold. And I'm not sure, but I think we were among the first hospitals in the world to go for the gold level. And how to make sure to get clean energy was the #1 big part of that, to reach gold. So what we have is that we have a technical building aside from the hospital, where we have boreholes that go into the ground, where we can actually store cold from the winter and use it for cooling in the summertime. And we use the excess heat from summer and store it for the winter so that we can reheat the building. We also have kind of climate shell, you could say. It's not possible, for example, to open any windows at Karolinska because we want to make sure that no extra heat or cold is getting released and can be seen as a net loss. So of course we need to have good ventilation as well. So yeah, apart from that, we made sure to buy 100% renewable electricity. And that's the agreement that region of Stockholm has when we purchase energy. So please, afterwards, don't ask me too technical questions about how these boreholes work, because I don't know. But basically, we do have this heat pump, and I know that it stands for 85% of all the need for cooling and heating in the hospital building. And we also make sure to take care of the heat recovery from equipment and people that are actually moving inside the building as well. But of course, you can build the best building in the world, but you also have to look at what you do with inside that building that has an impact. And we've been working quite a long time with environmental questions, I'm glad to say. And like I said as well, we're only one example out of many that practices this. So, one of the things that we focus on as well is digital solutions. We have a lot of healthcare being provided through digital solutions, both when it comes to recovering patients that you need to perhaps just check their medicine level. For example, the second picture you have there is a doctor checking up on a Parkinson patient, and they can, by video call, make sure to make different kind of movements, and the patient repeats them, and the doctor can tell whether or not the medication is right or if they need to change something without the patient actually having to visit a hospital again. And we also have the opportunity, since we have video calls through the operational wards, to help other hospitals and connect with them when we are doing surgery, to lend our help to other hospitals. I'm actually going to skip ahead a bit because I saw that Hajar was rising up. But these are a few of the examples of what we have accomplished in the few years since, I think, 2019 are like the baseline for these figures. But when we come to challenge it forward, we see a need to be able to calculate and affect Scope 3, something that Robert was speaking about as well. The need for a transparency when it comes to public procurement and what we actually demand of the market. If we are all in agreements on how to measure and what way to go, the market can respond and actually start working with these things. But if we all start asking for it in different ways, the market will be confused, to keep it simple. So there is a need for a common ground in this. And then you have the question of adaptation efforts or resilience efforts, what it's been more about for us at Karolinska, versus minimizing waste and overconsumption. Because on the one hand, you don't want to stock up too much supplies and everything within the hospital. You need to have a flow, so the expiry date on the different, like for example, single-use items or pharmaceuticals don't happen while you haven't used it yet. But at the same time, there is a need to be prepared and to be resilient. So that's kind of a nut to crack that I leave with you all. But of course, there is also a challenge for sharing our experience and best practice that we have. So therefore, I'm so thankful that we're all here today. Thank you very much.
Thank you so much. Thank you, Katarina. Thank you so much. We have quite some questions coming in for you. The first one is, how do these boreholes work? I'm joking. That was the one forbidden one, right? Scrap that. No, there's actually a different question that I wanted to ask you that one of the people, now there are a lot of coming in, but there's one specifically that somebody asked is, would these ambitions put more pressures in a healthcare sector that is already functioning with limited resources? I don't know how you're looking at that.
Oh, it's an interesting one that we battle every day, definitely. Yeah. Well, first of all, you have to be able to look at the long-term perspective. because usually if you choose to go like in an environmental green way, even if it's more expensive in the beginning, it tends to grow less so over time. I can use an example. For quite a few years ago, I worked there too long, but anyway, we had both paper mugs and plastic mugs by the coffee machines. And the reason that we had plastic mugs for quite a big amount was that they were cheaper. But we started to promote the paper mugs and told everyone it's worth it. You know, it costs a little bit extra, but we are ready to go there. So by the next cycle of public procurement, we had actually shown the suppliers that we were interested in the paper mugs. And they turned out to be cheaper than the plastic ones that we scratched. So sometimes you need to start to invest.
And hold on for a bit to make a change. It also makes me think of something that Robert mentioned, where he said that it would be good if, and of course, I think you were talking about medical products, but I think in general that products sort of also represent the intrinsic value, because obviously the plastic cups were more quote-unquote cheap because the environmental costs and the social cost of manufacturing with plastic weren't included in the price. So if we do that, it ends up being a whole different ballgame of sort of things that we, trade-offs that we make in weighing that. But I like that. Thanks for also giving that example. Everybody, can I once more get a big round of applause for Katarina? Thank you so much. Thank you. Oh no, we're actually concluding. I'll take this from you. Thank you so much. Because indeed we ran through all these presentations. We ran through the time, but it was very interesting. You asked a lot of questions, which I'm very happy about. So thank you so much for doing that. But I also want to give you a bit of a break because we've had a lot of programs so far, and there's a short coffee break that we have planned for you right now. So in a little bit, when we go out, there is a different round of posters that can be seen. Now, again, I want to ask everyone to, when you grab a hot drink, just walk by the posters, check them out, and vote for your favorite one in Slido. They have a corresponding number in the Slido overview. One other thing I will mention in a little bit, there will be a kids exhibition as well out on the hallway, because we have primary schoolers from the Berkendaal European School in Brussels who have built a model of a sustainable city that they would like to live in. Mind you, these are year 5 pupils, and they are sharing their own vision for a greener future. Very concrete, very tangible. So if you have the time, do make sure to check that out. With that being said, there are parallel sessions after the coffee break. We have 20 minutes of a coffee break. Make sure to check out which one you want to attend. And then we see each other again here in the plenary for session 4 later on. Thank you so much, and I'll see you soon.